Every 2 minutes, a mother in Kenya dies in childbirth. Many others suffer pregnancy-related complications. This can be prevented by women gaining quality healthcare at the right time, including reaching the hospital facility in time. In Wills for Life, women can call for free through our number 1196 to reach a doctor who listens to the patient's complaints and helps them. And in case of an emergency, the doctor sends either a taxi or an ambulance. The patient is picked from home and transported to the hospital and left in the safe hands of the facility. No pregnant woman should walk the journey alone, and no mother should lose their life while giving life.
Mimi ni mjamzito, nilikuwa na feel pain hapa chini. Nilicall around 10 usiku na ilikuwa time ya curfew. Nikapiga kwa call center 1196. Mwenye alichukua akani direct kwa daktari, anakuuliza venye una feel, alafu akaniambia nimpe like 3 minutes taxi itakuwa kwenye niko. Wakanitumia taxi na ikakuja ikanipick, ikanidrop Kenyatta. Nikakuwa tena mara ya pili sikuwa na feel tena poa. Nilikuwa na uchungu hapa juu. Ilikuwa saa 5 pia ilikuwa time 2 ya curfew. Hiyo time walinitumia ambulance yenye ilikuwa na daktari mwenye alinishughulikia, wakanipeleka tena Kenyatta.
Wills for Life began as part of solving a problem that we noted during COVID-19. I was working in the wards of Kenyatta and I realized that we were seeing very many mortalities that we had not seen in a while, or complications that we had not seen in a while. Things like bleeding. We were seeing very many women coming with bleeding, things like tears that were quite extensive, and of course complications of hypertension. And it saddened me because I couldn't figure out why in 2020 that's something that we were dealing with. I went to the root cause and I found that many of these women were actually waiting till morning to get to hospital, and simply because they lacked transport to get to hospital, none of them were going for their clinics because clinics had been suspended, and before then there was that fear of getting COVID-19, and therefore they had no access to information, and they also had no access to get to hospital. So having an emergency license, I thought that I would share my number so that they could actually call, and I would kind of give them antenatal advice as I try and get them to hospital. So what happened was we started with a tweet, and from there I had such profound feedback from the public that I realized I could not do it alone, and therefore I went to my friends, fellow doctors, and asked them for help. And of course I went to different stakeholders, Dr. Wala, KHF, AMREF, who brought on board Bolt, Telesky as a call center, and of course Rescue as our ambulances, among many other stakeholders, including the national government and Nairobi Metropolitan Services. So from there was birthed a very strong initiative that we termed Wills for Life. And basically all we want to do is to make sure our mothers actually get to know what to do. Pregnancy is a difficult journey, and I can attest to it myself. You want to know at every time that your baby is okay. And I found it easier that these women could actually call at any particular point and get to know from a doctor's perspective whether they were doing okay or not, or whether they required to go to hospital. We have reached, from the 30 calls I would get a day, we have actually served more than 3,000 women. We have dispatched more than 1,500 vehicles, that being cabs and ambulances, and we have saved more than 3,000 babies, which is quite an amazing feat. So women out there, you're not alone. Pregnancy is not a journey that you'd want to walk alone. Call us even during curfew, during the day, as long as you're within the 5 counties, that is Nairobi, Nakuru, Nyeri, Kiambu, Machakos, and Uasin, Gishu. And if at all you're not in that jurisdiction, even in the others, we can still do our best to get help to you, because we know that pregnancy is a difficult journey, and beyond that, we don't want to see mothers lose their life while giving life. So thank you.